Bismillahirrahmanirrahim. Rabbi zidni ilma. Every day is a chance to get better. Don't waste it. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and today I'm going to do a critical appraisal of an article under the supervision of Professor Dr. Sair Afzal. The topic of this article is patients and public views and attitudes towards the sharing of health data for research, a narrative review of the empirical evidence. The checklist which I'm going to use, narrative review checklist, it has 5 domains like title, abstract, introduction, methods, discussion/summary. And we are going to check 7 items in detail, one by one. Starting with the abstract of this article, the introduction. International sharing of health data opens the door to the study of the so-called big data, which holds great promise for improving patient-centered care. Failure of recent data sharing initiative indicates an urgent need to invest in societal trust in researchers and institutions. Key to an informed understanding of such a social license is identifying the views patients and the public may hold with regard to data sharing for health research. Methods. We performed a narrative review of the empirical evidence addressing patients and public views and attitudes towards the use of health data for research purpose. The literature databases PubMed, Medline, Embase, Scopus, and Google Scholar was searched in April 2019 to identify relevant publications. Patients and public attitudes were extracted from selected references and thematically categorized. Results. 27 papers were included for review, including both qualitative and quantitative studies and systematic reviews. Results suggest widespread, though conditional, support among patients and the public for data sharing for health research. Despite the fact that participants recognize actual or potential benefits of data research, they expressed concern about breaches of confidentiality and potential abuses of the data. Studies showed agreement of the following conditions like value, privacy, risk minimization, data security, transparency, control, information, trust, responsibility, and accountability. Conclusion. Our results indicate that the social license for data-intensive health research cannot simply be presumed. To strengthen the social license, identifying conditions ought to be operationalized in a governance framework that incorporates the diverse patient and public values, needs, and interest. According to checklist, the first is title. And the thing which I need to check is identify the report as a narrative review. Yes, it is in the title, the narrative review word was clearly mentioned. Regarding abstract, according to checklist, unstructured summary should be there, providing an unstructured summary where applicable background, objectives, brief summary of narrative review and application of future research and clinical practice or policy development. In this article, abstract was structured, basically including headings of introduction, methods, research, and conclusion. And the keywords at the end were not mentioned. Otherwise, all these things addressed in the points mentioned in the checklist. Introduction. Large-scale international data sharing opens the door to the study of so-called big data, which holds great promise for improving patient-centered care. Big data health research is envisioned to take precision medicine to the next level through increased understanding of disease etiology and phenotypes, treatment effects, disease management, and healthcare expenditure. Regarding details of the introduction, social license is identifying the expectations of society and may hold with regard to sharing of and access to health data. Relevant societal actors are the subjects of big data health research, constituting both patient and the general public. Identifications of patients and public views and attitudes allow for a better understanding of the element of a socially sanctioned governance framework. Research papers that have captured these views using quantitative or qualitative methods or a combination of both. So far, systematic review of the literature have limited their scope to citizens of specific countries, qualitative studies only, or the sharing of genomic data. Therefore, we performed an up-to-date narrative review of both qualitative and quantitative studies to explore predominant patient and public views and attitudes towards data sharing for health research. So in the introduction, what we were supposed to see was a rational background, describe the rationale or review of the content, what is already known, and the objectives, specify the key question identified for the review topic. As far as the background information, it was in detail, it was given, and yes, clearly mentioned the specific question to conduct this review topic. Next was the methods. In this article, the literature databases which are used for the search of PubMed, Medline, Embase, Scopus, and Google Scholar in April 2019. To merit inclusion, an article had to report results from an original research study, quantitative, qualitative, or mixed methods, on attitudes of individual regarding use of data for health research. And they were all published in English, and the studies were performed between 2009 to 19. So, since long, we only interested in empirical evidence, expert opinions, and publications merely advocating for the inclusion of patients and public views in big data health research were excluded from it. Okay, and it was in low or middle income countries of public health or care quality improvement were not considered relevant to this review despite our specific interest in data sharing within the European context. And the countries included were USA, Canada, Australia, and New Zealand. And the additional articles were identified through consultation with experts and review of references in the manuscript identified through the literature database searches. Views and attitudes of the patient and the public were identified from selected references and reviewed by means of thematic content analysis. So the key search items were different, were used patient or public or citizen or attitude or view or perspective, opinion, interview, qualitative, quantitative service. So how by this the search was done. So the study characteristics which were involved in the studies, they were under the different headings. First was the reference, the name of the author and where the study was conducted. Then the perspective, either it was patient or public in combination both. So the study aim was to examine patient perspective on the risk and benefits of linking existing data source for research. Date of data collection was then mentioned. Then the setting was like online patient community, patient link, and wherever it was done. Context of patient and citizen, websites, emails, social media. So the different modes from which this information was collected. Then the sample size, like here was it 351 says, and the male and female were. Then here it was 140/51 sample size. It was 280. So different sample size were here. And the methods were data collection. Somewhere questionnaires were used, cross-line online survey, then questionnaire, systematic review, survey. So these were the different categories or the study characteristics of the included studies, 27 studies. Next table was regarding patients' view and attitudes toward the sharing of health data for research. So the patient view overall willingness to share data, like strong willingness to give broad consent for the secondary data use. Like it was 93% in this study. So the motivations to share it, what they think they should. So altruistic health benefits for the earth, basically in healthcare. Then the perceived benefits of data sharing, helping my doctor make better decisions about the health. Then the perceived risks of data sharing, according to patients, were concerning the data could be not usually be de-identified, data security risks were there, then the stolen by hackers data health. So these were the different risks of the data sharing from the patient side. So then the barriers to share data. So financial gain, or if data sharing is motivated by financial gain or profit. So these were the different barriers. Then the factors affecting willingness to share data. There was significant association between country and attitude toward data sharing. So everybody was concerned about age and data sharing, diagnosis and data sharing. And the conditions was sharing the protection of privacy. So the studies that offer value and minimize security risk, researchers protect patient privacy and the information. So this was the table regarding patient views. In the next table, in this article, there were public views and attitude towards the sharing of health data. So in this, the overall willingness to share, then again, the motivation to share, altruistic reasons and contributing to the greater good, perceived health of shared data, then the perceived same headings, and the initially patient's view and now the public views. Then it was patient and public views in combination. Under same headings, they have said who wants and who doesn't want, share willingness, motivation, perceived benefits, and everything. Under same headings, these were filled. So according to checklist, in the methods, it was mentioned, specify the process for identifying the literature search, years, consider language, publication status, study design, and database of publish. This was all mentioned in detail of the included 27 studies in this review articles. Tables were there and have shown you already. Now comes the discussion. In this study, we narratively reviewed 27 papers on patients and public views on and attitude towards the use of health data for specific research. Overall, people express similar motivations to share their data, perceive similar benefits, despite some variations between patient and citizen, yet at the same time displayed a range of concerns predominantly related to confidentiality and data security. Awareness about access and control and potential harm resulting from these risks. Both patient and public participants conveyed that certain factors would increase or reduce their willingness to have their data shared. The goal of this narrative review was to identify the most internationally dominant aggregated patient and public views about the broad topic of data sharing for health research. We deliberately opted for the methodology of a narrative review rather than a systematic review. Most narrative review deals with a broad range of issues to a given topic rather than addressing a particular topic in depth. This means narrative reviews may be most useful for obtaining a broad perspective on a topic, and they often are useful in generating quantitative answers to specific clinical questions. However, because narrative reviews do not require specification of the research and selection strategy, and the way of critical appraising literature can be variable, the connection between evidence generated by narrative reviews and clinical recommendation is less rigorous and risk of bias exists. This is something to take into account in this study. A risk of bias assessment was not possible due to heterogeneity of the findings. We acknowledge that our methodological choices may have affected the discriminative part or granularity of our findings. For example, there's a difference between sharing of routinely collected health data versus secondary use of health data collected for research purpose. And we can only make loose assumptions about potential difference between patient and public views. In addition, we should mention that this work is centered around studies conducted in Western countries as the whole big data space and literature is dominated by Western countries, higher socioeconomic status and professions. However, most of the disease burden globally and within countries is most probably not represented in the big data, and so we have to stress the lack of generalizability to large parts of the world. Nevertheless, we believe our finding point towards essential elements of a governance framework for data sharing for health research purposes. If we are to conclude that the identified conditions ought to act as a pillar of the governance framework, The next step is to identify how these conditions could be practically operationalized. For example, if people value information, transparency, and control, what type of consent is most likely to valorize these conditions, and what policy for returning research results would be desirable? Once we know what to value, we can start thinking about the ways to acknowledge that value. A new challenge arising here, however, is what to do when people hold different or even conflicting values or preferences. Discrete choice experiments could help to test people's preferences regarding specific topics such as preferred modes of informed content. Consent, apart from empirical work, conceptual analysis is needed to clarify how people public trust. Trustworthiness of institutions and accountability are interconnected. Conclusion. This narrative review suggests widespread, though conditional, support among patients and the public for data sharing for health research, despite the fact that participants recognize actual or potential benefits of health research. They report a number of significant concerns and related conditions. We believe identified conditions like social value, data security, transparency, and accountability ought to be operationalized in a value-based governance framework that incorporates the diverse points and public views, needs, and interests, and which reflect the way these same conditions are met. To strengthen the social license for big data health research. Acknowledgement was given at the end. Contributors were mentioned. There was funding was reported. Competing interest non-declared. Patient consent for publication was not required. Province and peer review not commissioned, and open access and its ID was given at the end of this article. As far as the checklist is concerned, it does discussion and summary, which was the last domain, narrative and summary. In narration, they ask for discussion. The point, research review including fundamental key findings, second, limitation of the quality of research review, and third is need for future research. And the summary provided an overall interpretation of narrative in the context of clinical practice. So detailed discussion with the key findings of studies was done. Limitation and the quality of study are clearly mentioned with reasoning, and future need is mentioned as well. Conclusion, acknowledgement, funding, contributors, and competing research were also mentioned at the end. Now talking about SANDRA. A SANDRA is a scale for the quality assessment of narrative review articles. This please rate, when we read a narrative review, we use this checklist, which is SANDRA. Please rate the quality of narrative review article in questions using categories 0 to 2 on the following scale. For each aspect of the quality, please choose the option which best fits your evaluation using category 0 to 2. Freely to imply journal low or high quality. They are not intended to imply the worst or best imagining quality. So we have 6 domains in which we have to work. Justification of the article importance for the readers. And the different options where the importance is not justified, the importance is alluded to but not explicitly justified, the importance is explicitly justified. So I gave marks 2 in it. It was fulfilling. The next was statement of concrete elements of formulation question. Yes, I gave 1 in it. Then the description of the literature search. Yes, the literature search is described in detail, including search terms and including criteria. I gave 2. Referencing. The referencing of key statements is inconsistent. Yes, so I gave 1. Then the scientific reasoning. Appropriate evidence is introduced selectively. 1. Appropriate presentation of data, relevant outcome. Yes, it was given in detail. So I gave number, and out of 12, I scored 9 to this article. This is our YouTube link. Kindly like, subscribe, and share. And thank you so much for everyone.